Diabetes Management and NCLEX. Hi everyone. In this video, we are going to talk about diabetes and what the NCLEX will focus on for this topic. So let's get into it. So when it comes to diabetes, there are three main things that you need to know. One is what type of diabetes the patient has. Type 1 diabetes is an autoimmune process where the body is destroying the beta cells in the pancreas that make insulin. So these patients will require insulin for the rest of their lives. With type 2 diabetes, the body is resistant to insulin or the pancreas isn't producing enough insulin. These patients may require insulin, but they may also require oral medications as well. No, 2 is understanding how to administer insulin. So there are different types of insulin. There's rapid acting, short acting, intermediate acting, and long acting. And the nurse needs to know when to give the different types of insulin before meals or after meals, as well as what the peak times are for the different types of insulin. So just know that type 1 diabetics will always need some type of insulin either in a pump or they'll need to do injections. And then type 2 diabetics may or may not need insulin, but they may need other medications such as metformin or sulfonylurea, glipizide, glimepiride. You need to know the side effects of those medications and the patient may self-administer those medications. 3 is hypoglycemia and hyperglycemia. So hypoglycemia is when the blood sugar is less than 70 milligrams. DL or less than 3.9 ml, and hyperglycemia is when the blood sugar is greater than 180 milligrams. DL or greater than 10 ml. So the signs and symptoms of hypoglycemia are tremors, sweating, anxiety, irritability, and confusion. And the priority nursing intervention for hypoglycemia is to give the patient something to eat or drink that contains glucose such as orange juice or apple juice. If the patient is unconscious, you're going to give them something like a glucose gel or a glucagon injection. For hyperglycemia, the priority nursing interventions are going to be monitoring the patient closely, checking a blood glucose every 15 minutes, checking ketones, providing patient education, and then administering the ordered medications such as insulin. 4 is patient teaching. So you need to know what the patient has been taught regarding their diet, exercise, stress management, and medication administration. And 5 is complications of diabetes. So that includes diabetic ketoacidosis, DKA and hyperosmolar hyperglycemia state, HHS. The patient is going to have an altered mental status because of the high blood sugars and the ketones. With HHS, the blood sugars are really high. There is usually no ketones and the patient may appear very thirsty. Alright, so if you want more diabetes questions, make sure to leave me a comment and let me know which state board exam you are taking. I really appreciate it. Thank you so much for watching and I hope you found this video helpful. Take care.